My name's Penny Krispin, and I'm going to talk a little bit about the old days when I was known as Nurse Pickle, taking care of HIV patients here in Dallas. I graduated from Baylor Nursing School in '83 and rented a little garage apartment from a little lady in Commerce. And she's very sad. Her son had died 2 years earlier, and my mother said he had died of cancer. And she told me that he was a very artful designer. Later on, when I moved to Dallas, I was told by some of the DGLA and some of the doctors here that he was the first guy that died of AIDS in Dallas County. So unbeknownst to me, that was my first brush with HIV. I graduated from nursing school in '83, and I went to the ICU and the ER to work, and that was my passion, and I loved it. But one day they were short on the cancer floor. It was about 1985, I guess, and they said, there's a clinic patient in there. His name's George. He's a clinic patient. He's probably Medicaid, but he's got AIDS. And I'm like, oh gosh, I've never taken care of AIDS patients before. I needed a little bit of report. I'd never done it. I'd done ICU work. And they were like, when you come out of the room, go in with a mask, glove, gown, everything. When you come out, no matter what it is, throw it in the red hazard bin, silverware, trays, everything. So I walk into the room, and this guy's got on silk pajamas. I'm like, I don't think this is a clinic Medicaid patient. The guy was filthy rich, okay? He could have bought and sold every nurse on the unit. And so I thought, I don't know what this is all about. I'm not, we haven't been in-serviced on it, but this is intriguing to me. One of the other nurses said, do you want to make some extra money? Of course I did. She said, you should go into home care, and you can just do a few extra visits when you're not in the ICU. And so I got a job at a home care company, and one of the first patients I saw was out on Corinth Boulevard, a workman's comp case, and I don't know if you know where that is, but it's out in South Dallas, and I would have to call him and tell him what time I was going to arrive at his doorstep so he could hold his gun out where everyone else in the apartment complex could see, so that I could run to his door and get inside safely, where roaches would crawl over my feet while I tried to do his visit. But I was like, okay, this is my job. Somebody's got to do it. I'm the nurse. So I come back, and they say, do you think you might be interested in seeing people with HIV? And I said, well, sure, yeah, I've actually had a case. I'm fairly familiar with it. So they handed me the entire AIDS docket. Now, I'd like to think it was because I was a good nurse. It's probably because I had a burr haircut. I'm not sure. But I went from gun waving in South Dallas to the first apartment I walked into for my first HIV case was a 3-story condominium decorated in Louis XIV. I was home. So I thought, okay, they want to put these patients on me. I'm in absolute splendor and glamour. They're making me tea and coffee and crumpets that I've never tasted before. What's the deal here? So I sensed, a reticence on their part, some kind of problem with treating people with HIV, which I couldn't imagine because I thought I had just landed the most posh job I'd ever had in my life. So the pharmacist said to me, you seem to have a knack for this. In other words, you look like a lesbian. Why don't we start our own company? Because they obviously don't, this is something they are only doing, for the money anyway, so let's do it. So we started a small company. We didn't have very much money. We put it together. We got our shingle. We had to buy so many drugs to open up our pharmacy and everything. We were almost flat broke. Dr. Robert Fine called me. Well, let me back up a minute. My next door neighbor was Graham McLean, and we were, as I said, we were about to go broke. I don't know if any of you know Graham. He was a very handsome Australian doctor, MD, PhD from Australia, and he just happened to be a resident at Methodist when I was a nurse there, and he came over for dinner one night, and he said, there's a treatment in San Francisco that is an aerosol treatment. It has virtually no side effects, and it will stop PCP. Well, at the time, you know, if I had a patient with PCP, I usually didn't have them a second time. It was that virulent and that tough to treat and that tough to keep from coming back. So he gave me the protocol, and simply because we were such a small company and we had no red tape to go through, since there were only 3 of us, I went and got a compressor about the size of this speaker up here, and within 1 week we were given aerosol pentam treatments. We still were almost broke, and Dr. Robert Fine called me and said, a patient of mine has told me you have a treatment available that I think might be appropriate for him. His name is Terry Thibodeau. And so we started treating Terry. He was recovering from lymphoma at the time, and I've told people on many occasions, when we were about to go down the drain, his first check from his insurance came to our company, and the rest was history. He and Bill were both my patients, and they were not only my patients, but they were my strongest advocates. But they saw how benign the treatment was, the few side effects it had, and how well Terry recovered from it. And they said they need to be offering this at Parkland, because at the time we had no other treatment. And so William Wavern and the Dallas Gay Alliance, Mike, and several people went to Parkland and asked for the treatment, and they were, denied that. So the DGLA, and I brought the nurses, the pentam, the machines, they brought the patients, and we started treating. And so I guess it was about a year and a half when we treated probably 25 patients every Wednesday night. It was just a once-a-month treatment, so we treated a couple hundred people or more until Parkland began to give the treatment, until we started realizing that aerosol pentam could be replaced by Bactrim, which was a much cheaper and a much better tolerated treatment. But I can tell you right now that I personally had patients that I cared for during that time that are still here today because of that. And I'm not saying me, I'm saying those guys that stood up and said, you know what, we're going to take up the money, we're going to raise it, we're going to treat these guys, and we're going to do our part to keep this thing alive. And they did. A lot of people have asked me, well, was that illegal, or did you was your license in jeopardy or anything like that? Aerosol pentam was not approved for that indication, but it was approved, so it was not against the law. We were in the paper and we were on the news, kind of showing Parkland for not being the caregivers they could be, but it was not against the law. What was against the law was the stockpiles of medications that we kept for, and I see a lot of people nodding, for people that didn't have insurance and stuff like that. And I'll leave you with this thought. I was very concerned about my license because it was my livelihood. And we did have this huge stockpile of drugs, and anybody that needed it could come and get it, because a lot of people would become allergic to this, or they'd stop this, or they'd change to that. So we would keep it, and we would give people what they needed. So I went to my grandmother, who was my moral conscience at the time, and I said, I don't see how we could keep from giving out this medicine. These guys need it. There's no other place a lot of them are going to get it. Parkland, some of the drugs are very expensive. They won't get it there. And she said, it's against the law for you to do that. So that would be a crime. But if you didn't do it, that would be a sin. A lot of you know my brother died in 1992. It's still hard. I know it's hard for you. And there are a lot of people here that were sick before him that are still alive today, thank God. I want to thank you for this opportunity and this honor. And I stopped doing HIV medicine in '98 when nurses like me weren't needed as much because people went on a PO regimen. So a lot of people breathed a sigh of relief that Nurse Ratchet was gone. But I'm back in nurse practitioner school, so watch out.